Hello and welcome to the Washington AHEC Scholars Podcast. My name is Jordan. I am the Senior Coordinator for the Southwest Washington Area Health Education Center. We're continuing our series and podcast this week talking about climate change and how it can impact patient healthcare outcomes. And joining me today, we have a special guest, a physician with University of Washington who does work related to how climate change affects patients. I'm going to go ahead and toss it to him to introduce himself.
Great. Thank you so much. Glad to be here. Thank you for having me. Yeah, my name is Stefan Wheat. I'm an assistant professor of emergency medicine here at the University of Washington, and I am the planetary health theme director for the University of Washington School of Medicine, which means I design and implement a curriculum around planetary health, which includes climate change for the medical student curriculum. I'm also the co-director of education for the Planetary Health Alliance's North American Regional Hub. So it's my responsibility to and purview to educate clinicians of all backgrounds across North America around this topic. So yeah, my work focuses on this kind of intersection of climate change, health equity, and medical education. And my goal is to help health professionals understand, prepare for, and respond to the health impacts of our changing climate.
Okay. Wow, that's really fascinating. Sounds like you have quite a bit of experience with it. For myself, it's kind of one of those things that you tend to think of life domains, It's like, how does this impact this and impact this, impact this? And it's like specifically climate change, how does that impact patient health and community health outcomes? So maybe that would be a good lead into how did you get into this work? So you're a trained physician, and then did you have a personal passion for climate change, or what brought you to this point in your career?
Yeah. So I think there were a number of different things, and I won't go into the full story, but I think early on in my career, I was seeing kind of how environmental conditions, things like heat waves, wildfire smokes, extreme storms they're not just like background events in the background, but they're actually direct drivers of emergency department visits and adverse health outcomes for the patients I was trying to serve. I remember there was one patient early on in my career during my residency, which was actually down at the University of Arizona in Southern Arizona in Tucson, that was a migrant who had been crossing the desert and entering the United States and had been crossing the desert for weeks. This was the hottest and driest summer on record for Southern Arizona. And it was not surprisingly also the most deadly for this population of people. And this was a young I think 20s woman who was pregnant, and she was suffering from heat stroke, and she ended up intubated and in our ICU because of that. And I think that was kind of a watershed moment for me. Is like, wow, this is really bad, and I need to be starting to think about this a little bit more.
Okay, yeah, wow, that would be a up close and front and personal with being experienced and directly seeing how that impacts patients. So then let's kind of shift into talking specifically about how climate change is a health issue. Students who have no background, maybe they're kind of somewhat interested in climate change as a topic, but they've never really dived into it. How would you explain why climate change is a health issue, not just an environmental one?
Yeah. So I think this also gets to kind of my background and how I got into this. But one of my kind of foundational experiences and getting involved with this work was actually a volunteer experience I had before even going to medical school. It was with an NGO called Health in Harmony. And the kind of model of this NGO was to partner with communities around national parks. Currently, or at the time, they were just working with communities around several national parks in Borneo, in West Kalimantan. And what this organization did is that they recognized that there was this, practice of extractive logging from these rainforests that these communities were participating in. And they went to these communities and they said, what do you need in order to, avoid participating in this practice? And what they said is that they needed healthcare. And I think the kind of foundational essential model that I walked away from this experience realizing is that you can't really expect people to care about the environment until they have their basic needs met. And one of those basic needs is their health and the health of their family and their community. So that was a really powerful and foundational model for me. And as I started learning more about this topic in general and climate change and how it impacts health, I think you quickly start to realize that climate change isn't just about melting ice caps or, endangered species, which I think is the kind of traditional model of thinking about environmentalism in general that I think a lot of us grew up with in the late 1900s. It's about people and health. The same shifts in weather and temperature and the ecosystems that harm the environment also change the conditions that we live in, that we breathe in, and that we depend on. So extreme heat can trigger heat stroke and worsen heart and lung disease. Wildfire smoke can cause asthma and COPD exacerbation. Floods can lead to waterborne illnesses. We depend on the environment to be healthy, and climate change is making it harder and harder for our environment to support us.
Yeah, yeah, good points. I think for myself, being a child of the 90s, even in my relatively short lifespan, I don't remember the wildfires is a good example where, sure, like, every summer there'd be one or two fires that would kind of take off. But the first year that I can remember here in the Pacific Northwest having that really bad smoke completely settling in the area was 2012. And prior to that, like that had been an unheard of thing to just have like off the charts air quality index. And then, of course, we're still kind of unpacking what are the long-term effects of that. And then feels like every other summer now we've had that similar thing. So we've
Right.
had to come front and center in the Pacific Northwest here about really how directly the environment can impact our health.
Right. Yeah. It's very up close and personal for us.
Yeah. Which right now it's August 2025 as we're recording this, and I feel like I go outside and that little bit of tinge of haze because we do have a fire nearby us, and it's just like every day we're seeing it more and more. So are there specific populations or communities who are more affected by climate-related health issues? Like I mentioned, that's an example of what we experience here in the Pacific Northwest, but are there some other areas or populations that are more affected?
Yeah, absolutely. Many of us in this field of climate change health, planetary health, we like to frame climate change as sort of a threat multiplier. So disparities in climate impacts often actually reflect existing health inequities. So meaning that climate change can magnify social and economic vulnerabilities that were already present. So, there are a number of different populations that are commonly cited. Children with their kind of developing bodies and immune systems, they're more vulnerable to heat and air pollution. Older adults with multiple medical comorbidities are often more vulnerable to various different climate hazards. Low income communities, rural and indigenous communities, and pretty much anyone with pre-existing health conditions are at increased vulnerability to many of these hazards.
Yeah, that's interesting you mentioned that because, as we're kind of continuing to adapt to it, I've started to see a little bit of the data come out about asthma and the effects of like the wildfire, the smoke's been coming out. So we really are needing to have that much more front and center in our minds about all how those things play into patient.
Absolutely.
Yeah. So for our scholars are soon to be practicing clinicians. For them as they graduate and start to take up their practice, what does a climate conscious care look like in an everyday practice setting?
Yeah, this is a great question. I think so. I think it generally starts with just being aware that there is a problem, right? The reality is that many clinicians, while they are aware of climate change and they recognize climate change is real, and they don't always translate that into what can I do in my everyday practice. And so beyond that, it's taking action to kind of start implementing solutions. So that can look like screening patients for risk factors and counseling them on how they can stay safe at home during a heat wave or when the air quality is really poor. This is how I think of that every direct patient care clinician can contribute to the resilience of healthcare systems that we know is already being strained by by climate related disasters. I think we don't have to look that far into our history back in the 2021 heat dome here in the Pacific Northwest, which was this massive climate related event that was definitively proven to not be possible, and the severity of that event to not be possible without climate change. That really strained our healthcare systems here in the Pacific Northwest. And so healthcare professionals in their day-to-day practice can help their patients stay safe and healthy at home, reducing the stress on healthcare systems during those events. We also know that here in the US that healthcare accounts for about 8.5% of our total US greenhouse gas emissions. And that results in significant direct and indirect harm to the patients, we're tasked with serving. And, I go so far as to say that, I think that directly butts heads with our oath as physicians to do no harm. So, fortunately on this front, there are tons of things that we can do, and it's not really rocket science. Most of the waste we contribute to in healthcare is a result of low value care. Practicing evidence-based medicine and delivering high value care is a solution unto itself. I like to teach my students to reduce low value care, to be thoughtful about the waste they're generating in the course of the care they're providing, and especially as an emergency physician, making sure that our patients are plugged in with primary care resources, because again, the best way to reduce the carbon footprint of healthcare is to keep people healthy in the first place.
Yeah, that kind of preventative model. I was thinking when you're talking about the overstressed healthcare situation, one of the most recent memories I can think of when we had this really bad, I keep going back to the wildfire smoke because that's what's most prescient in my mind. 2020, of course, that first year during COVID when we were having the shutdowns and everybody staying at home. I was living in Seattle at the time, and it was the same thing. We were having really bad smoke that summer. So it's like the little bit of respite you could have had from being stuck at home all the time was to go outside, but then you couldn't do that even because of how bad the air quality was outside. And so that summer was just miserable for so many people being just stuck in. And then, of course, the overtaxed healthcare system, and then other social services that weren't being able to be used. So, like you're mentioning, really important that we kind of begin to adopt that preventative care model and how we can kind of reduce the stress on our systems.
Right.
So here in AHEC Scholars, one of the main things that we like to do is have that interdisciplinary approach. We bring students together from different healthcare backgrounds, nurses, doctors, physicians, dentists, physical therapists. So how do different members of the care team play a role in recognizing and addressing health impacts of climate change in their patients? Or maybe a different way to think about it would be, how do you see an interdisciplinary team working together to respond to how climate change affects patient healthcare outcomes?
Yeah, that's a great question, because I think it's important to recognize that we always in the course of providing care to our patients, we're almost always working as a team, and it's, I think, unrealistic to expect any one member of the team to be taking on this task of addressing climate change as a hazard to the health of our patients just all on their own. And so I think there are a number of different ways that healthcare professionals from different disciplines can approach this issue. Physicians and advanced care providers like PAs and NPs can identify climate sensitive conditions and counsel patients on risk. Nurses who often spend the most time with patients, I think they're ideal for reinforcing prevention messages, identifying social needs and implementing, climate resilience protocols across the hospital. I think, the way I see it is, a physician or an NP or a PA can identify someone who's at risk. A nurse can counsel them around some of their risks. Pharmacists can help support them around their medications and how their medications might put them at higher or lower risk for some of these hazards. And social workers can support patients in identifying ways that they can stay healthy in the community, like identifying where their local heat shelter is and how they can access resources for home air filters and the like.
Yeah, okay. This question is kind of interesting for myself. When I was in school to become a counselor, they were actually this discussion about adding to the DSM, the Diagnostic Statistics Manual for mental health providers, like adding a diagnosis of climate change anxiety, something that could be directly addressed in a therapeutic setting. And I think there's still kind of some debate about whether or not that would be useful, but still, like, it just kind of demonstrates how it's something we need to be addressing in every facet of healthcare.
Yeah.
For sure. So going back to our students, as they're becoming providers, what are some ways that they can begin to think about addressing climate thinking in their rotations or clinics or in classroom settings?
Yeah, I think I love this question, and I love this question of thinking about how do students get involved and start thinking about this in the course of their rotations, working in clinics and hospitals. The first thing that I would reiterate, is my prior point about reducing low value care. I think we engage in low value care in medicine all the time. Some estimates suggest that almost 30% of the care provided in the US is low value or wasteful care and provides essentially no benefit to the patients we're trying to serve. And so this is also care that is carbon intensive. So using recommendations like from the Choosing Wisely campaign and other similar groups can help us identify the interventions in our day-to-day work in our clinical practice that are low value and help us think about how do we cut them out. And beyond that, I think it's also worth being curious around the care we provide, just asking questions. Why are we ordering that test? Does it actually help us to make a decision about the care of this patient, or is it unnecessary? Right? I think we should all as clinicians be asking those questions, but things like the Choosing Wisely campaign and other groups can help us frame that and give us ideas about what is low value care. And then I think students in general are actually leaders when it comes to some of this work. And I think the reality, for better or worse, I'd say for worse, unfortunately, is that students may actually have more formal education than the clinicians, doctors that they're working with out in the community, because this is a relatively new movement. So helping your preceptor and to think about this issue and identifying the patients, who may be at risk for heat stroke or asthma exacerbations due to wildfire smoke, and helping them to put a plan in place to support these patients, actually may be a really helpful contribution, in the course of providing clinical care.
Okay. Yeah. So really beginning to think on all facets of care. I like that point you bring out about even thinking about reducing unnecessary spending and waste and stuff in your care being just like the first easy step that a lot of clinicians can take. Do you have any advice for how to approach colleagues or patients who are skeptical about climate science or how it's connected to health?
Yeah. So I think, the reality is that the first step is realizing that, we as clinicians, we always have to meet our patients where they are. And the good news is that we as physicians, we're already experts at this communication thing. We translating complex scientific ideas into something that is clear and digestible for a lay audience is what we do in our everyday practice. So we're already really good at it. And the second piece that I would hone in on is that we need to realize that we never actually need to mention climate change when having these conversations with our patients in order to help protect them. If you live in the Northwest, as we've been talking about, you don't have to be a climate scientist or even believe in climate change to see that, wildfire smoke is essentially a regular part of our summers, and that results in poor air quality. And talking about, the issues that are relevant to the patient in front of you and connecting it to their world is what is important. And one of my heroes, Katharine Hayhoe, who is a climate scientist, she wrote a book called Saving Us, which is just a phenomenal book, and I'd recommend it to anyone. But one of the things she says is that it all begins with understanding who we already are and what we already care about, because chances are, whatever that is, it's already being affected by climate change, whether we know it or not. So helping our patients and our colleagues and whoever we're talking to make that connection between how climate change is impacting that thing that they care about is, I think, an important first step.
Okay, I really appreciate that point. Like, you don't have to completely lampshade it. You can just, this is the reality of the situation, and this is what we need to address. So you mentioned Katharine Hayhoe is one of your personal heroes. Do you have any other organization toolkits, networks you'd recommend for students who want to learn more or get involved that they can connect with?
Yeah, absolutely. So especially for medical students, here in the US, there's a fantastic group called MS for SF, or Medical Students for a Sustainable Future. They are a group of medical students who are involved in advocacy, they're involved in education, and it's a national group, and there are chapters all over the country, including here in the Pacific Northwest. The Medical Society Consortium on Climate and Health is a consortium of medical societies that are focusing on this issue. And here in Washington, there's also the let's see, we have Physicians for Social Responsibility. They have a climate and health working group, which is really a great group, and they're very happy to have students be a part of that. The Planetary Health Alliance is a larger international group. I mentioned that I am the regional director for education for the North American regional hub for that. They're also a great group to get involved with and are happy to have students get involved. for specific tools that clinicians and students can use in their day-to-day practice. The AmeriCares toolkit on climate and health, it has a lot of amazing clinical guidance. And then specifically for engaging in those conversations, another tool that I helped develop with another NGO, Eco America, is the Climate RX tool, which is a tool that's helps to promote conversations between patients and their providers, and is easy for and free for anyone to get.
Okay, yeah, some good resources and connections. I can personally vouch for AmeriCares. We've actually had them come and present to our scholars in the past, so good group of people. So what excites you about the work that you do? Climate change, this topic can sometimes kind of feel doom and gloom at times. So what gives you hope? When you wake up in the morning and you're excited to do your work?
Yeah, I think it's a good question because I think that this is a topic that can sometimes feel overwhelming for people. And I'll say that there's actually some research that has gone into this of, what helps people overcome that kind of doom and gloom feeling. And what's been found is that it's really hard to overcome that doom and gloom feeling alone when you try and tackle something like this alone. But when you're tackling it as part of a larger group and you have community around this to work on this kind of issue, it is protective. So identify the people you can work with and collaborate with to address these issues, and I think that's a powerful next step. I think what gives me hope and what's excites me about the work that I do is often working with students, because students are so excited and interested and curious about this issue, and that energy is very contagious.
Yeah, very good. Yeah, as a community psychologist, I can definitely vouch for one of the best ways to allay anxiety is to have a group of people, like-minded people that you can spread those worries with. Well, thank you so much, Stefan, for your time this morning. Maybe just to wrap up our conversation, if students were to take away one thing from, what would you like students to take away one thing from this conversation?
Yeah, I think the one thing I'd love students to walk away with is that you have a lot of power to promote change in this movement. If this is an issue that you care about, I would encourage you to get involved. The Planetary Health Interest Group at the University of Washington School of Medicine would be a great place to get started. The origin story of our curriculum in planetary health and my position as the planetary health theme director at the School of Medicine started with students demanding this as being a part of their curriculum. And so you have the power to make change, and I would encourage you to use it.
Awesome. Thank you so much. Well, thanks again, Stefan, for your time. Really appreciate getting to hear your thoughts. It sounds like you're doing some fantastic work, and there's definitely opportunities for our students to get involved if this is a personal passion of theirs as well. I can, in fact, some of the resources you mentioned, we'll be sure to pass those on to the students when we get to this module about climate change. So thanks
Awesome.
again for your time. Yeah, it was
Yeah.
really great
Thank you
talking.
so much.